guys, today I'm here to teach you about hand washing. The topics include hand washing and procedures and the steps included, and then advantages, disadvantages, and the products used for hand washing. Hand washing is the process of cleaning one's hand with soap or detergents or alcohol-based solutions to remove viruses, microorganisms, bacteria present in the hand. Hand washing, it is the most simplest and most effective method of stopping or preventing microorganisms. Let's go to the basic sections of the hand washing. Always remove your rings, bracelets and anything that is in your hand. Let's go one by one. When will you wash the hands? When entering and leaving the work, and while using the toilets, and before eating food and after eating food, and then when touching uncontaminated things, and while you sneezing, coughing, and all this. While doing this, you should wash your hands with at least 60% alcohol if soap and water is not available. Key situations where hand hygiene should be observed the following are: when you touch a patient, even if gloves are to be worn, and the second step before coming out of the patient's care area after touching the patient's immediate environment, and then after contact with blood, body fluids or excretions or wound debris, and the fourth, prior to performing any septic task, example like placing an intravenous line or preparing for an injection, and if hands are likely to move from contaminated body side to a clean body side during patient care and after removal of gloves. And as I already told, you should wash your hands before and after eating food, before and after you go to a toilet, and before and after you touch contaminated clothes and all. United States Center for Disease Control and Prevention (CDC) recommends following three basic preliminary steps while washing the hands in order to avoid the transmission of pathogens or microorganisms. So the first step is removal of rings, bracelets and all, as I already mentioned earlier, and apply enough soap to cover all the hand surface and rub hands to produce enough lather you produce while using this soap. So these are the three preliminary steps recommended by the CDC. We are going to discussing about the 7 steps of hand washing procedure. The first step is rubbing hands palm to palm. Rubbing hands palm to palm. Step is right palm over dorsum with interface fingers like this. You should do this procedure in the left hand. Third step is palms to palm with interlaced fingers like this. Fourth step is back of fingers opposing palms with interlaced fingers. Is rotational rubbing of left thumb clasped in right palm and vice versa like this. Step is rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa like this and this. So the last and final step, rotational rubbing of right wrist and vice versa like this and this. Rinse hands with water and dry off with single-use towel, and then turn off the tap with that towel, and then wear gloves. So if you are alone while performing this hand washing technique, you should use your elbows to turn off the tap. After performing all these hand washing techniques, you should always keep your hands like this, just because now your hand is contaminator free. So if you touch a contaminated surface, microorganisms will enter your hand surface. So you should always hold your hands like this, and not even touch your dresses also. Wearing scrubs, outer scrubs, and not even you don't touch your hands to the scrubs and your dresses that you wear. Okay. We are going to discuss about the substances that are used for hand washing. First one is soap and detergents. So soap and detergent, detergents comes under the classification of surface active agents, which we studied in the sterilization method. These act by denaturing the protein and disorganizing the microbial lipid bilayers. Okay. The second substance is solid soap, and solid soap we are not using in surgical hand washing and OT procedures just because it reusable nature. It may hold the bacteria from our previous uses. So this is hot water. Still we are not using hot water as an efficient method just because bacteria can grow even at grow faster than 37 degrees Celsius. That is our normal body temperature. So it's not considered as a preferable method for hand washing. Important substances that we are using in the hand washing techniques, that is the use of alcohol and hand washing procedures. 60% of alcohol containing substances are we using for hand washing procedures just because we know the most common alcohols are isopropyl alcohol and ethyl alcohol. Methyl alcohol are even used, but the most commonly are isopropyl alcohol just because it is a skin-borne antiseptic, it will kill the microorganisms more efficiently. So the advantages of hand washing techniques are we can remove microorganisms that enter into our hand, then enhances our personal hygiene, and the advantages of hand washing technique. Also the disadvantage, the disadvantage of the hand washing technique is that while if we are using excess amount or adequate use of hand washing with alcohol cause our skin dryness, so it is the disadvantage of hand washing. Hope I made it clear for you all. So if you like my video and understand it, you should like, subscribe, and then if you guys having friends, you should share it. And if you are having any doubts regarding this topic, you can comment in the comment section. And if you want notes too, you can message me in the comment section. And thank you for watching this video.